So to start us off today, we're going to talk about what every man over 40 should know about prostate cancer. Ideally, I know prostate cancer is very common. It's actually the most prevalent cancer in Kenya among men, followed only second by the common cancers we hear about, breast cancer. And I think having this space where we talk about health conditions and things affecting men, this is a conversation starter for every man above 40. So we're going to enumerate things that you should know and you should be cognizant of so that you're able to take charge of your health. So first of all, what is a prostate? What is the prostate gland? So the prostate gland is a gland in every man. Every man is born with a prostate gland. And it's located just below the bladder and in front of the rectum. Its purpose is usually in the provision of the part of the fluid that contributes to the semen during ejaculation. So that's its main purpose. And as you grow, your prostate increases in size. And that's why every conversation among men, they talk about muthuri or what the prostate is. It's because you all have it and it serves a purpose in your body and it affects the quality of life as you age. And that's why it's usually a conversation past the age of 50 upwards. So that is what the prostate gland is. 2, we've talked about what its function is. How do you get prostate cancer? What are the risk factors? Number 1, genetics contribute a great deal in the history of prostate cancer in your family. So if you have a father, a brother, an uncle who had prostate cancer, it is good to have it checked. Number 2, you have being a man of African descent. It increases your chances. There are actually studies that have been done that show that prostate cancer in itself is more prevalent among black men. There are studies that are currently running in Kenya, genetic studies that are showing a big disparity between the white demographic in terms of the data we have from the white population, the Caucasian men, against the African man. So being African predisposes you to higher chances of getting prostate cancer. Number 3, we have age. Age is a great factor. The older you get, your chances are higher. So if you're above 45 and you have familial history of prostate cancer, important to get checked. Number 2, if you're above 50, your chances double up, they go higher, so that's a time to check. And number 4, I think that's number 4, very important, lifestyle, obesity, exercise, these things that affect the health of your prostate. And we're going to talk about lifestyle things that you're able to do to improve the health of your prostate. So how will you know? How will you know that I have prostate cancer? Or the important thing to know is that prostate cancer is very indolent. In indolent, I mean it's silent. By the time you have the symptoms for prostate cancer, you might be a tad too late. And that's why screening and examination and being screened early on time goes a long way. So how do we screen? There's something the prostate produces. It's a gland, so the hormones it produces in the body that help you know how the prostate health is. One of them is PSA, that stands for prostate-specific antigen. It's a hormone that circulates in your body, so we just take a blood sample. Nowadays, there are tests that take less than a minute to check, so PSA is the beginning of it. And the one thing that men fear the most is a DRE. A digital rectal exam is basically an examination that your urologist is able to do in the examination room, where they put a finger where the prostate is. We said it's just anterior to the rectum, so you put a prostate through the rectum, you examine it, know whether it has any nodularity, whether there's any pain, whether there's any tenderness. That's how we examine the prostate. So we've looked at the risk factors, what puts you at risk. When you come to a urologist, what to expect and what we'll be looking for in terms of screening and examination. Then the other thing that you need to know is, so what are the symptoms to watch out for? We've said it's silent, it's indolent, it takes its time. So the number 1 thing, you have to be cognizant of it, and that's why we are going for early screening. Screening and detection is important. So what are the things you'll be looking out for? You'll be having issues, you might be having issues of obstruction, you'll be straining, you'll be having intermittency or hesitancy. That is, when you want to go urinate, you feel like there's a lag before the urine comes out. Intermittency means you pee and it keeps breaking, or you can have that strain. You have to force the urine to come out. You could have frequency or urgency or nocturia. Frequency is the increased number of times you go for urination. Urgency is that when you want to pee, you have no time, you have to run. And nocturia is the number of times you wake up at night to go pee. Normally, people pee twice a night. So if you have to go pee more than 3 times, there could be a problem. However, the disclaimer here is those symptoms could also be associated with what is known as benign prostatic enlargement. This is where the prostate enlarges normally. We've said every man is born with a prostate. It increases in size, and this can actually give you the same symptoms. The other thing of note, as we've said, it's silent. It's silent in the sense that it does not come announcing itself like the way breast cancer, you'll see a lesion on your breast, or you'll have pudgy orange, like breast patients present. Prostate is silent. However, the only other symptom you could present with is back pain or bone pain, because prostate cancer metastasizes to the bones. It metastasizes to the bones. So you could have bone pain that could actually give you symptoms, or anemia or weight loss. This is when the prostate cancer is a bit more advanced than we actually hope for. So once we know what we are suffering from, these are the symptoms we are looking at. What happens? So you come to the urologist, we screen you, we do your PSA test, we know the PSA is okay, we look at the prostate size, we know whether it's functioning correctly, we do a digital rectal exam. But then again, now there are options. If you don't want a rectal exam, there are tests we can do. Then after that, what next? So you've gotten your symptoms, you've come to the urologist. What do? We'll do the PSA, we'll do the DRE, we look at the prostate health and how it's working. And then once you're diagnosed, what happens? There's line of care depending on the staging of the prostate cancer, where it is. By staging, we mean, is it in the prostate? Has it moved out? Does it involve the lymph nodes? The lymph nodes within the pelvis, those things we call ngai. So those things, are they enlarged? Are they to the extent of involvement? And there are options in the management of this prostate cancer, from surgery. Being a surgeon, surgery is where I lean to. But if it's advanced and it's gotten outside the spectrum of surgery, there are medications that can be given for the same. So when all is said and done, early detection saves lives. So come in for screening if you're a man above the age of 40. If there's familial history, 45. If you're African, we're all Africans. If you're African and you have familial history of prostate cancer, come in. We don't have to wait for the situation to get worse. You need to come in early. Then the other thing, how do you protect yourself? How do you maintain prostate health and make sure everything is fine? Number 1, lifestyle changes. If you're smoking, stop smoking. It's never good for any organ in your body. Alcohol intake, you can cut it or reduce. And then the other thing, healthy lifestyle. Exercise. If you're living a sedentary life, it affects your prostate health directly. What you eat goes a long way. So balanced diet. We usually recommend, and the books recommend, a Mediterranean diet. These are foods that are rich in seafood, that's fish. Then it have to be salmon or oyster, but it can be fish, omena, vegetables, fruits that actually improve your prostate health. This is Dr. Shirley Achoka, and this is the Ultimate Uro Guide.